everyone. Happy Tuesday. A day before Valentine's Day, so we think about hearts and love, and I am thrilled that we're going live with something that has become almost a tradition for us. I have invited my dear friend, Dr. Deborah Kelly. We've sat down for the last few years at this time of the year to talk about women's health, particularly focused on heart disease, because February is the Heart Disease Awareness Month. And who better to talk about this than Dr. Kelly, who is one of the senior partners at Piedmont Internal Medicine. And I am so happy that she is my personal doctor and one to many of us in the community, and so incredibly knowledgeable. So welcome and good morning.
Thank you. Good morning.
Like I said, it's an important month to talk about heart disease. It's not just bringing awareness of the existence of heart disease. We like to talk about prevention and treatment. So let's start with that. Let's talk about first the primary focus on identification and prevention of heart disease, not just in women, but with our focus on it.
Well, it's certainly important to address it and recognize the risk factors, because it is the #1 cause of morbidity and mortality, both globally and in the US. So it's very important, and this is the month we highlight it. So you really want to look at your risk factors. Risk factors include high blood pressure, so you need your blood pressure checked, high cholesterol, family history, male gender is more of a risk factor, also tobacco use, alcohol use, stress, obesity, sedentary lifestyle. So these are all things that need to be addressed, and you need to speak with your internist to discuss healthy lifestyle choices, diet, exercise, have your blood work taken, and periodically, given particular age and risk factors, doing CT calcium screens to look for plaque that can indicate coronary disease, and we want to attack it before primary prevention.
Yeah.
But once we find it, then there's certainly ways that we treat it as well.
I think that that's so important to understand the risk factors, absolutely. We talked a little bit before about how often and how early we should have patients come and visit an internist. I, from my perspective, see younger and younger patients that are so educated and aware. What are you seeing, and what are the recommendations? When should patients come to see you guys? When they should start talking about these potential risk factors?
Well, over 18, we start seeing patients, and they should have blood work done every 3 to 5 years at least, looking at their cholesterol. So we, as our practice, do that at least every 2 to 3 years over 20. It is recommended to do it annually over 40, to keep an eye on both your sugar, your kidney test. Kidney disease is a risk factor for heart disease as well. Of course, the cholesterol, and diabetes is tremendous, a tremendous risk factor for heart disease that needs to be addressed.
Such a common problem in the US and around the world.
Mm-hmm.
So once the specific risk factors are identified, I know we talk about diet a lot as one of the things that you can do to adjust. Let's talk a little bit more about that, because I know that you have a relationship with a nutritionist at Piedmont. We've actually sent patients to them as well with great success.
So you really want to focus on a low inflammatory diet, which is a Mediterranean diet. So I always counsel patients that you want to really focus on protein and veggies and fruit, and lower in the carbohydrates. I term it, to make it easy for them, the white things, which is going to be bread, rice, crackers, pasta, potatoes, of course, dessert and wine. So you want lower in that, because you want your glycemic index lower. And it's very important. Sugar causes inflammation, and you need to decrease inflammation in the diet.
Yeah, and it's interesting because that glycemic index so important to us as dermatologists as well, because we talk about the inflammatory changes that affect skin conditions as well. So I think that that's a very important element. We talked about exercise. You did disappoint when you said wine, not even a little glass of wine for Valentine's Day. Come on, like that little red glass of wine.
Well,
red wine.
Actually, with regards to red wine, is fine. There are flavonoids, that there are antioxidant properties and antithrombotic properties to it, but it's the quantity is super important. So 5 ounces for women. They can have 1 glass a day that's acceptable, 2 glasses for men.
Those guys.
I know.
So then, great things, diet, exercise, but then of course there are patients that need to go on medication. So what are the current recommendations when you do identify a patient with changes in their cholesterol profile?
So it depends on, one things we are checking now is a lipoprotein A, if the cholesterol is high, and an apolipoprotein B, which gives us genetic markers that look at. So if you're positive on that, we will start a cholesterol medicine sooner because that is a genetic risk factor. Also, we take in consideration if the CT calcium score is positive. If it's positive, we need the LDL bad cholesterol less than 70. And a lot of the cardiologists are even driving it lower than 55 now. If you have diabetes, even if you have a perfect score on your calcium score, they're recommending to start cholesterol medications to get the LDL less than 70 again. So it really depends on the risk profile of the patient, the genetic markers, what the CT calcium shows, and then address it that way. And of course, keeping the blood pressure well controlled, keeping an eye on the kidney tests. And another big factor is to treat and help cardiovascularly is really reducing stress. Stress is highly inflammatory for the body, and it also causes vasoconstriction. So it's causing vasoconstriction can trigger blood pressure issues. So really working on healthy lifestyle choices there. You need plenty of sleep, 8 hours a night of sleep. Stress reduction, so yoga, meditation, what can work for you, because you really want to reduce the stress because that will trigger.
Yeah, I think that, it's so, I think things that we have thought about and the cultures before us have highlighted, really now are coming together to understand, when we can live our best life, and early diagnosis, early identification, early awareness, and then really making the right choices, sleeping well, exercising, the right correct diet, and then great help from your primary care physicians and cardiologists that I know that
absolutely.
You are sending your patients to. So once, if there are patients that are in your hands that do have a diagnosis of cardiovascular disease, has much changed outside of medications, therapeutic approach, other diagnostic approach? You mentioned that CT scan for calcium score. Anything else that's going on that's newer?
Well, a lot of times a cardiologist may opt, before going to a cardiac cath, the CTA, the CT angio. That can look, that's when they give you dye. So it's a step beyond just the CT calcium score, but not a cardiac cath, to see what degree of stenosis in the coronaries they do see, and if there is any. Sometimes they'll also employ MRI stress tests. So there are those that are on the cutting edge of medicine, but the traditional things are going to be taking a baby aspirin per day if your plaque score is over 100. Keeping the blood pressure well controlled, 120/80, getting your LDL less than 70, and again, sometimes the target's less than 55. So we take all those into consideration to help the patients live their best healthy lives.
I think that one of the things that I remember from 500 years ago when I was in training is that the symptoms that women present with are maybe a little bit different and not the typical symptoms. So that's why I do think awareness of your risk factors and potential disease is so high. So how do women potentially, medicine is so broad, nothing is typical, but when you talk to women, what should they be aware of if they do have heart disease? What are the symptoms that are a little bit different than in a male patient?
Well, of course, the classic ones is chest pain, shortness of breath, if you can have left arm radiation, jaw radiation, but sometimes women present more just with maybe indigestion, GI symptoms, gastrointestinal symptoms that are atypical for coronary disease, but that's why you always have to have a high index of suspicion when you're seeing a patient, and then looking at their family history, their vital signs, their lipids, their labs, kidney disease, diabetes, and address it from a multifaceted approach. And if it sounds suspicious, you need to look for sure, if they haven't already had any diagnostic screens before.
I think that again, don't ignore symptoms, really get checked, not just in the month of February, but really year round.
Absolutely.
Well, thank you so much.
It's a pleasure.
Love having fabulous friends in different medical specialties. So what an honor to have Dr. Deborah Kelly with me this morning. We heart you in the month of February. Take good care of yourself, get sleep, exercise, eat well, and make sure that you come and see your doctors.